with Lucky Tomaszek, who is a midwife in the Milwaukee area, to talk about a planned home birth and midwifery care. So, Lucky, thank you so much for joining us today.
Thank you so much for inviting me. I'm very excited about this.
Fabulous. Well, would you tell us just a little bit about yourself, a little bit about your background?
Absolutely. And I also want to quickly say that I'm having some spring allergies right now. I know you wouldn't be able to catch COVID through the computer anyway, but I don't want anyone to worry. I'll probably sneeze a little bit. A little bit about myself and my background. I started doing birth work all the way back in 1998. So I've been at this for quite a long time. I started as a doula and I was certified by DONA, which used to stand for Doulas of North America, but now they're a worldwide organization. So I'm not sure if they changed what that stands for or if they just still use the name. And I became a childbirth educator and a La Leche League leader. And when I moved to the Milwaukee area in 2000, that's where I had my first baby here my third baby, excuse me. I had my third baby here in Milwaukee, and the midwife that attended my birth invited me to apprentice with her. So I started training as a midwife in the year 2000, and I worked in midwifery and continued to do doula work until 2006. And then I took what I thought would be a short break. That was the year that we finally got licensure in the state of Wisconsin. We weren't licensed providers before that. And so I took a break while they were doing all of the things necessary to institute licensure. And I thought it would be short, but it ended up being quite a long break. It ended up being about 10 years away from midwifery, although I still did doula work, especially for friends and family, did childbirth ed and breastfeeding support. But in that time, I also became a sexuality educator and learned a ton about the differences between biological sex and gender identity and working with different groups of sexual minorities, and found that the work I had been doing in birth and the work I was doing in sex ed really weave together really nicely, because what I think everybody wants to know is that, like, they're normal, they're not weird, that their bodies are cool, whatever it is their bodies are doing. So I worked in sex ed, and I still do. I'm still a sexuality educator. And in 2016, I decided I wanted to come back to midwifery. And I have been working in midwifery since then. And now I am licensed by the state of Wisconsin and certified by the North American Registry of Midwives.
That's fabulous. And I love that your journey, where it might have started with doula work and midwifery care, you took this kind of circuitous path and picked up all of this great information to just really be able to provide great care to your community.
Oh, thank you so much. It's been really fun. I would never be able to say that I like one of those two roles more than the other. Like, they're both so important to me. I think America has a real shortage of holistic sexuality education information, just as we have kind of a shortage of holistic healthcare providers.
Definitely.
Yeah.
So for those of us who may not be overly familiar with the birth world, would you mind just telling us a little bit about the differences in different types of midwives? What's the difference between a doula, midwife, and OB?
Yeah, absolutely. Yeah. Okay, so let's talk about the difference between a doula and a midwife first, because I think that is a point of confusion for a lot of people. So doulas are amazing. And if you're expecting a baby, and no matter where you want to give birth, I highly recommend working with a doula. Like, doulas are so great. And so a doula provides education for you during your pregnancy, starting at whatever point you hire a doula, usually with a specific number of visits, though, like 2 visits or 3 visits or 4 visits, whatever's in their package. But they really kind of augment whatever childbirth education you've had, so that the things that go on with your body in labor and during birth are often less scary if you know what's happening, right? If it's not all a surprise. surprise. And I would say even for people who've already had a baby or two, labor can still be kind of a surprise. Like there can still be things that happen that didn't happen before. So they help you figure out what it is that you want for your upcoming labor and birth, and then attend you during your birth to make sure those things happen as near as they can while still having a safe birthing environment for you. And then they stay a little bit postpartum and are available by phone and usually an extra appointment for breastfeeding support and things like that. They can recommend things to keep you comfortable in labor, places to push on your back or your shoulders, remind you to eat and drink. All of those things. Doulas are amazing. I know that some of the hospitals in the Milwaukee area aren't allowing doulas to attend in person right now because of COVID-19. And I don't have a list of which hospitals those are. I'm sorry. I feel like it's kind of changing a little bit from week to week, and it's been hard to keep track of. But the doulas out there who have already signed up to work with pregnant people for labor and birth are still providing virtual care, which I think is super important to know about because yes, a doula brings her hands or their hands to your birth, and they can push on your hips and hold you up and hold your legs back during pushing if that's what you want, and all of those things. And those are super valuable. But a doula can also, from a distance in a virtual realm, kind of talk your partner or other support person through the physical aspects and still provide you with great informational and educational support. So even if a doula is not going to be able to attend your birth in the hospital with you, I think it's still worth checking into doula support. So midwives, so that's kind of a doula role. Mm-hmm. Midwives, what we do is we are partners with you in your actual health care. So during your pregnancy, we're going to see you on the same schedule that an OBGYN would see you. So every 4 weeks, and then every 2 weeks, and then once a week. During COVID-19, some of us are deciding to do a portion of those visits virtually, and then some of them are still in person for clinical care as well. But we're actually doing the things that you think of when you think of going to a doctor or going to a nurse midwife. So we're listening to your baby. We're checking your blood pressure, checking your pulse. We're measuring your belly. We're recommending ways to stay healthy and fit. If you've got concerns about your pregnancy, about a clinical aspect of your pregnancy, you'd call us. You feel like the baby isn't moving as much as you might expect or things like that. And then when you go into labor, we've already discussed like when to give us a call, and we attend you for your whole labor, birth, and 3 or 4 hours postpartum to make sure that everyone in the family has eaten, everyone is cleaned up, everyone is ready to go to bed. And we carry the supplies we need to ensure that you have a healthy and safe birth. So that means that we have oxygen and resuscitation equipment. We have medications if we think you're bleeding too much after the baby comes. We check your vitals. We listen to the baby with a Doppler throughout your labor. So we have all of those things with us. And we're really trained in differentiating like low risk or normal labor from high risk or abnormal labor. And we're not afraid to help people make a transition to the hospital at any point during their care if we believe that's the safer option. And so a midwife like me, a licensed midwife, we're attending births in your home as opposed to in the hospital setting. Yeah, midwives and doulas. I think that's the difference there. And your other question was about the difference between midwives and OBGYNs?
Yeah, or even thinking of a licensed midwife like yourself versus a certified nurse midwife, if there are any big differences there.
I think one of the biggest differences there is that a nurse midwife primarily practices in the hospital. There are some nurse midwives in Wisconsin who do home birth or birth center birth. But the vast majority of nurse midwives are working in the hospital setting. And they're working with usually with an OBGYN practice. And so they are following the guidelines of that practice. Usually with a nurse midwifery practice, there are several nurse midwives in that practice. And when you go into labor, you'll get the person that's on call. And probably during your pregnancy, you will have had a chance to meet everybody at least once, but it's not quite the same as working one-on-one with a licensed midwife. There are some advantages to nurse midwifery. They can prescribe certain medications for you if you need them during your pregnancy. If you get an infection and need antibiotics and things like that, they can take care of that for you. The home birth midwives in Milwaukee are very lucky. We get to have a bridge program with the nurse midwives at Sinai. So even if you're in care with a licensed midwife, if something starts to deviate from kind of that low risk circle that we're used to seeing, we can help you make contact with the nurse midwives over there and get additional testing or get the treatment to resolve it. And then assuming it resolves, you can still work with a home birth midwife for your actual birth itself. So I really appreciate the work that's gone into making that bridge program so that our clients can have all the kinds of care they need.
Yeah, and then people who are interested in working with a licensed midwife, working with someone in their home, they do have a little bit of the best of both worlds, where if they need additional just care or additional services, it's very easily accessible, and it's someone that you trust and know. So it's very likely that then they will be able to build a good relationship with as well.
Yes, I agree. I think it's a nice overlap there. And I have lived in a couple of places outside of Milwaukee where these kind of integrated relationships between the medical community and the community and the home birth community are really well established. And it's such a blessing. It's such a blessing. And I'm glad that we're working with Sinai on that. I hope to see that expand across the country even more, because there's still kind of a divide in a lot of areas of the country between the home birth community and the hospital-based community.
Definitely. And that's where I think we can see just one thing that Milwaukee has done really well in supporting pregnant people and parents to be is that there are a lot of those resources out there. It's just a matter of being able to find them and take advantage of them.
Yeah, you just have to figure out how to tap into them, right?
Definitely.
Yeah.
So tell us a little bit about any big differences between working with a midwife and working with an OB.
First, I'll just mention the similarities real quickly because I think they're important. As I mentioned before, we follow the same schedule. So every 4 weeks during your pregnancy until you're 28 weeks, you'll see us just like you would an OB. And then it goes to every 2 weeks until you're 36 weeks pregnant. And then it's once a week. And that schedule's the same. We have like lab work that's done through a blood draw or through a culture. Licensed midwives in the state of Wisconsin have the ability to perform those tests ourselves and submit them to the lab. And those are similar to what you'd have in an OBGYN's office. We can order ultrasounds too, if that's desired. Most people at least want an ultrasound around 20 weeks. Although with a midwife, if you don't want that, you can usually opt out of it as well. And then, we carry, as I mentioned, a lot of equipment into your home for your birth to keep you safe and keep baby safe. The difference really comes, I think, in the attitude between most community midwives and most OBGYNs, although certainly not all OBGYNs, where I think of myself as a partner in your care. I think of us as two people who are working together, and I'm going to bring my knowledge and my training and my education and my previous experiences to you, and you're going to bring your knowledge of yourself and your family and what has worked for you, and we're going to talk about the options that work best for you. So that includes testing, that includes our visit schedule if you need a modified visit schedule, that includes potential interventions during your pregnancy or labor or birth if they seem appropriate. And we're going to make those decisions together, where a lot of times with an OBGYN, you've chosen to do that because you like that model of care. You like to know that somebody else is making these decisions, that they've studied, they've got their degree, and they're going to tell you what's best for you. And that feels comfortable to you. And that's a really valid way to feel. So that's one of the things. The things in care with an OBGYN are often pretty prescriptive. Like it's week 20 and we do this at week 20. It's week 28 and we do this at week 28. Where community midwives often want to talk to you about, this is what is standard of care. This is why it's the standard of care. This is what I can offer you. And these are all of your options. As you can imagine, those conversations aren't short. So the other big difference between your care during pregnancy between a community midwife and an OBGYN is that our appointments are usually 45 minutes to an hour long. And in that time, we are talking about all of your options, and what you're comfortable with and what kind of decisions you want to make for your own care. And we're also getting to know you, getting to know your family. We think of ourselves as guests who have been invited into your home when we come for your birth. And that means that you need to trust us to come into your home, and we're willing to invest the time it takes to build that trust. And we want also to trust you. We want to know that if the rubber hits the road and we need to say something that we think you won't like, that you'll at least hear us out and talk about options with us. So it's a two-way street, that trust. Unfortunately, due to the way the insurance industry kind of manages all of the healthcare in the United States, your appointment at an OBGYN, most of your appointments are going to be 15-minute slots. And of that 15 minutes, you're going to spend about 6 minutes with your actual healthcare provider. And I know a lot of OBGYNs who wish that was different. They don't love that model of care. And they've been really boxed in by whatever hospital system they're working with, and they don't have a lot of power to change it except in kind of exceptional circumstances. So that's the other big difference, is the amount of time and communication that we dedicate.
And as a healthcare provider who does tend to be a little bit more on the holistic side, and that's my preference and how I treat, I know I can definitely appreciate the added time that I have to work with people and talk to them and get to know them. And I'm lucky to work in that model of care, because I have a lot of colleagues who don't have what has turned into a little bit of a luxury with that aspect of time.
Yeah. Yeah. I would say, I want to add really quickly that one of the other big differences between giving birth in your home and giving birth at the hospital, and this is hospital birth with a nurse midwife or an OBGYN, or maybe you're one of the lucky people who's got a family practitioner who's still doing OB care, which is awesome. In the hospital, you have access to pain-killing medications that we do not carry for home birth. So that's an important difference for some people. I can't do an IV line with any kind of morphine derivative medication in it. And I can't do an epidural at home, and you wouldn't want me to. But that's not an option at home. So for people who feel pretty certain that they're going to need pain medication for their labor, home birth isn't a great option for you. And when I'm talking about, like, we have medications and we've got emergency supplies, pain medications are not one of those things. We encourage you to eat and drink and move around and change positions, and you can use water, either a tub or a shower, for pain relief, and it's really effective, but it's not the same as having an epidural. So I like to be upfront with people about that.
Yeah, and I think that's so important. Anytime you're working with any type of healthcare provider, is having those types of conversations and knowing what to expect and what they can offer and how that may or may not be a good fit for you and what you're looking for, so that you are able to develop that trust and that rapport and just have a really great partnership.
Yeah. Consent is really the cornerstone of my care, and consent starts with information, and so people can make the decisions that are best for themselves, their bodies, and their families.
Definitely. Yeah. And I know we could go off on a whole other tangent about that.
At another event I did recently as a sexuality educator, somebody asked, like, what thing about sex ed could you talk about for hours? And I was like, consent. I could talk about consent. Yeah.
I love it.
We won't right now, though. That would be boring for other people.
There we go. Well, so when someone works with you specifically, what do kind of prenatal care visits look like?
Yeah. So as I mentioned, right now we're doing some visits via telehealth. So, and some are in person. Initial visits are always going to be in person because we do a physical and things like that that you can't really manage across a video monitor screen. So in-person visits, again, they're like 45 minutes to an hour long. And they're going to include having a conversation about how you're feeling. There's a long checklist of questions that we go through at every visit about, are you having headaches? Are you having unexpected urinary frequency? Are you having any there's a long list, and we do that because it's an assessment of kind of how your overall pregnancy is. Once you're feeling the baby move, then we ask at every visit, are you still feeling baby move, and those sorts of things. So that's kind of the touchy-feely talky part. That's very important. I don't mean to make it minimize that in any way. It's really important. But then there's the clinical aspect where we are measuring we do it on the outside of your body. We measure the height of your uterus through your abdominal wall. It's a lot of pregnant people's favorite parts because once the baby's big enough to feel, we're also feeling baby. We can tell you what position baby's in, what they're doing. And really, if you want, we can help you find baby too and teach you how to identify those parts so that you can play with your baby anytime you want. We're checking your pulse and your blood pressure and doing any other kind of routine clinical things that we think are appropriate. And so that's prenatal care. If we're doing it via telehealth, then we're mostly doing the touchy-feely talky parts. So we're going to alternate those visits, and we're available for contact all through your pregnancy by text message or messaging, like emailing through the electronic health record. So that's kind of our availability. And then for birth, did you ask that yet? I looked at the notes.
No, that was my next question.
Your next question. Okay. So we're gonna come to your house at the point where we both agree that it's a good idea. You as a laboring person have a lot of input into that, but there are times when we will also say it seems like it might be too early, and if we come now, like, people will tend to feel kind of like a watched pot, and it might actually slow things down. So maybe we'll check in by phone a lot, or we'll check in person with you, but then leave for a little while and give you some more space and come back. We can do that as many times as it feels appropriate. But from the point where it seems like a good idea to come and stay, then we're just there with you. I don't attend births by myself. I always have an assistant with me. Often that assistant is another licensed midwife. So as often as possible, that other assistant is another licensed midwife. And we might have a third person with us as well if we've got someone else to be a pair of helping hands, or if we have a student with us, that person would come as well. So most of us do not feel like it's safe to be the only trained professional at a birth. So there'll be two of us. Even during COVID-19, you're still allowed to have your partner with you at your home birth. The people who live in your house with you full time are all welcome. And then another support person. So that might be a doula that you've hired. It might be a brother or sister, a member of your family, or your best friend. And if you have older children who will be present, I would like to have a person who's there just to hang out with your kids and answer their questions and make sure they're not feeling scared and that they're getting meals regularly if it's a longer labor. During that labor, I can do some of the things a doula does with offering position changes for helping ease labor or speed it along if that's what we think you want. I can do hands-on care, hip squeezes, knee presses, all of those things. But in the role of a midwife, I also really like to facilitate that kind of support coming from either a member of your family, your partner, or your doula if you have one. And part of that is because the most intense part of my work as your midwife comes right as the baby's coming. During your pushing and birth and the immediate postpartum is when I really need to have all of my energy and all of my focus, because that's when things are, the most critical kind of.
Mm-hmm.
So I would like to facilitate your partner or other support person helping you through the labor, because really, it's your family. This is, you're coming together as a community, and you're going to be the ones raising this new family together, but also in a sort of selfish way of preserving some energy for the big show kind of at the very end. And then, as I said, I do stay for a few hours postpartum. I want to make sure that baby's latched, that you've gotten to eat, that your bottom's been checked to make sure that you don't need any stitches. And if you do, that you get stitched up properly. That's a thing that we can do at home, as long as it's not a really severe tear. If it is, we would help you get in to see a surgeon who puts the back together more often and take care of that. And then we come back postpartum, and we see you between 24 and 36 hours. At 3 to 5 days, again, we're back at your house. And then we're seeing you for visits at 2 weeks, 4 weeks, and 6 weeks postpartum. So you've got a lot more postpartum care than you typically do in a hospital setting. It's a lot. I talked a lot again. Lauren, I always talk a lot.
I love it, but I know that about you, so it's great. And you always have such wonderful information.
I'm glad
to
you
share.
knew when you invited me.
When you get going, you just get going, and I love it. Yeah, and I did want to circle back to one thing that you said about just facilitating their support system that they already have, and part of that as a way to preserve your energy for the moment where that baby is being born, but also just in that idea of this new family is being created, and helping that family and those new bonds develop in that moment in time as such a wonderful just aspect of the care that you provide, and something that I know I connect with very deeply on that level of we're a piece of the care, but we aren't necessarily we don't have to be this huge role in it, because we're facilitating so much of what this person already has within them and what they already have within their support system.
Yes. Yeah. Early in my time as a doula, which was also early in the days of the internet, because it was so long ago, I saw a quote that says it's an adaptation from the Tao Te Ching. I've never found a place in the Tao Te Ching where this looks like it could be an adaptation. So take that for what it's worth. But the quote is brilliant, which is, you're a midwife attending someone's birth. Do nothing. And if you must act, do it in such a way that the parent can rightly say, we did it ourselves. I will definitely act if it seems like the safety, the physical or emotional safety is at risk. I definitely will do whatever is needed to do to help with that. But for the most part, when you look back on your birth, what I want you to remember is your own strength and your relationships with the people who were around you in that moment. Because I love taking care of families, and I love being part of your lives for 8 or 9 or 10 months. But ultimately, that is the length of our relationship, and the people who are with you, the other people who are with you when you're giving birth, are probably going to be with you for a lot longer than that. And those are the most important relationships to develop.
Absolutely.
Yeah.
Fabulous. Well, any other questions that you feel like someone typically asks when they're deciding to work with you or work with a midwife, or anything else you wanted to mention in regards to working with someone with the current COVID-19 situation?
Yeah, actually, this is what I do so I can remember the things that I want to talk about. I put up however many fingers it is that the things I want to talk about. So the first thing is we'll talk about COVID-19 and the other ways that it's changed our care. We already talked about telehealth visits, and some of those are in the prenatal and some of those are postpartum. So it's good to know that going in, so that if you have an expectation of seeing someone in person every time. But other changes are that midwives, most like licensed midwives or professional midwives like I am, historically haven't been wearing a lot of PPE at births, gloves for sure, and maybe shoulder length gloves if you're having a water birth. But not face masks and face shields and things like that. And now with COVID-19, we're wearing more covering, and we're being even more careful than we used to be about our equipment and making sure it's clean before we bring it to you and making sure it's clean when we leave your house. There's a much heavier emphasis on that than there has been historically. So until COVID-19, I don't think I'd ever attended a birth with a mask on. And now I do all client care with at least some kind of mask on. Remembering always that my mask protects you from me and your mask protects me from you. So when I'm wearing that mask, it's to keep you and your family as safe as I possibly can. So, there are some changes in the kind of care in that way from COVID-19. And if you are like really kind of hooked on birth and you like to go and watch birth videos and look at birth photos, you may not historically have seen pictures of midwives in masks. So you might have a different expectation. So know that in person care, there'll be a mask on and other forms of PPE as we feel are necessary. So that was one thing. The second thing that people want to know in general, and historically, since I started doing birth work in 1998, what people want to know is how much does it cost? And that's a really fair question. I never want anyone to feel nervous or embarrassed about asking that question. It's really important. So midwifery in the city of Milwaukee, depending on what provider you choose, home birth is going to cost most people between $3,500 and $5,000. A lot of midwives offer discounts for early pay or flexible fee scale based on your income. I do offer that as well. And you know what, I can't remember what my rate is. Is it 34 to 44? I think my rate is $3,400 to $4,400 with a flexible fee scale for people to choose the amount of money they feel like they can pay. People want to know when they have to pay by. You have to pay your fee by 36 weeks in general, unless you've made other arrangements with the midwife. A lot of us now take Badger Care for Badger Care families, and I am a provider for Badger Care as well. A lot of people don't know that even if you've been turned down for Badger Care when you weren't pregnant, you may be qualified for it when you are pregnant because the income limits go up substantially when you're expecting a baby. So the limit goes up, plus your baby counts as a member of your family, your unborn baby counts. And so people qualify for Badger Care during pregnancy, even if they don't qualify when they're not pregnant. So that's something to check into. A lot of us are taking insurance now. I'm working on setting up with a biller. Unfortunately, we are not in network with any insurance. They will not allow us to be in network, which means for a lot of people, our fee is still going to be less than your deductible and copays would be for an out-of-network provider. But we can be really open and honest with you about that, so there are no surprises. So we have each midwife has a fee agreement they would present to you so that you could see it and know what the expenses are up front, so nobody's caught with a bill they didn't expect at the end of their pregnancy.
Definitely. And I know there are a lot of people who can appreciate that and just know what to expect. As someone who does enjoy working with a lot of providers for my own healthcare who do tend to be out of network, knowing what an upfront cost is so I can plan for it, for me personally, is really helpful.
Yeah, it's really important to be upfront about money. Anyone who's known me for more than 5 minutes knows that I'm not a fan of capitalism, but as long as we're all kind of forced to live under it, I want people to have the best resources that they can to have the care that they need.
Awesome. Well, anything else that kind of comes to mind while we give anybody who's listening an opportunity to type in any questions?
Anything else? I'm just real glad you invited me for this. This is real fun. I think like a lot of us right now, interacting with other people seems extra special right now. And so this has been really great. I think I'm on there as my name, Lucky Tomaszek, but I practice, my business name is Transitions Birth Services for Everybody. And you can find me on Facebook at Transitions Birth Services, or my website is transitionsbirthservices.com. And I would love to hear from folks. If they've got more questions or they're interested in learning more about care, you can contact me on Facebook or through my own website too. That would be great. I'm very excited every time I get an email right now because life is so boring and slow. I shriek, oh, I got an email. It's so exciting.
Oh yes, any type of interaction right now is welcome.
Exactly. Exactly, it is.
Well, thank you so much for taking time out of your day to hop online with us today and
Yeah.
just share your wealth of information and a little bit about the amazing work that you do.
Well, thank you so much for having me. I hope we get to hang out again soon, online or in person when it's safe.
There we go. I love it. Well, if anyone who's listening right now or is watching this as a replay, please feel free to reach out to either me or to Lucky. And we look forward to any questions that you might have. Have a wonderful afternoon.
Thanks so much. Bye.